Hello. Yes, I beat you into this room. I know, usually you have to wait. I finished up early with the previous patient, so thought I would come on in. The nurse took your vitals and everything right out in the hall. Your weight, everything like that. Okay, great. Yeah, sorry if you hear barking in the distance. We have I don't know if it's a vet's office or a pound that they've established next door, but hopefully the barking stops and it doesn't disrupt us a little bit too much, you know. Okay, so you're here for a cranial nerve exam, correct? Alright, good. We're in the right place. Let me just double check some things. You had a recent fall. Okay. And did you have any, like, symptoms after that? Okay. Okay, so your primary doctor said that they just wanted to get you checked over. Has anything like this happened before? Okay. And you don't feel concussed or anything, correct? Okay, yeah. Yeah, it's kind of silly how, like, some things can, I don't know if silly is the right word, but injure us more than other things. I've had somebody who has hit their head on a more high up counter, like, you know, just coming up, and really messed them up. And then we have people fall on the concrete and they're completely fine, you know. So, cranial nerve exams. I'm going to test your eyes, your ears, your nose, and your mouth, as well as just sensation of your face and a couple other nerves, but we'll go along with that, okay? Alright, so is it okay if I touch your face and just everything kind of going on with your head right now? Okay. Alright, I just like to check before I begin. I'm going to do some feeling of your face first. Where exactly did you hit your head when you fell? Look back. Okay. Alright, yeah, let me just see. Are there any lumps or bumps that you've noticed from a little bit of swelling? Yeah, okay. Oh, right there. Yeah, I feel it. Okay. Is that the only spot that really took? Okay, yeah. Okay, I'm just gonna check around your hairline. No scratches. I'm sure your doctor checked you for all of that, right? Okay, good. Okay. So I'm going to have you shut your eyes really tight. Alright. And I'm going to try to open them. Don't let me open them, okay? Good. Resistance there. Now open your eyes. And it's going to be kind of awkward. Don't let me close them, okay? I know. Eyelids are kind of fragile. They're not as strong as other areas. So you did your best. There you go. Okay, now I need to feel around your jaw. Okay, and bite down, clench your teeth. Okay, and open your mouth. Okay, I'm going to push on your jaw. Don't let me close it. Good. Okay. And can you smile real big for me? Good. And frown. Okay, and scrunch your face up. Okay, good. Good, good, good. I'm going to feel your neck a little bit. Check in the lymph nodes. your collarbone. All seems good there. No injury to your neck, right? Your doctor checked for that. Just gonna feel your neck and a little bit of your spine. Nothing hurts when I'm pressing on it, right? Good. I think we're going to start with your mouth because I had already checked your jaw and everything. So I'm going to put this popsicle stick in the mouth and just observe. You didn't bite your cheek or anything, right? Open it. Thank you. No damage to your teeth that you've noticed. Good. Sometimes people's teeth take a beating when there's a fall or so. Okay, so yeah, go ahead and put your tongue to your cheek. Okay. And your left. And up. And down. Didn't bite your tongue either, I see. Okay, good. I'm going to test your taste, okay? So I have a common flavor here. And I just want you to try a drop of it and let me know if you can tell me what it is. Okay. Do you have any food sensitivities or allergies? Okay, good. Good, yep, peppermint. Very good. Checks out. Good to move on now. Alright, so back to your eyes. Can you stare straight at me, please? Good. Okay. Now, I don't want you to move your eyes right now. I'm going to bring the light in, and I'm just going to run them past. I want to see how they react. Okay, dilation seems pretty good. And this lighting, okay, that's normal. Okay, that's about normal as well. Good. I'm going to split you down the center here and check one at a time. Make sure the reactions are as they should be. Good. Now, please focus on the pen light here. Come out. And back in. Yep, you're gonna go cross-eyed. Very good. Out. And back in. And out. Okay. Now, follow the light around for me. Good. Sorry if I'm a little shaky. I probably didn't have enough for breakfast, so we're coming up on lunch though. Good. Down here. And over here. Good. Now I want you to tell me when you see my fingers come into your view. Again, stare straight at me. Testing your peripheral vision here. Okay. Good. 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 Okay. Good. Perfect. Good. trouble with your eyes that you've noticed? Blurry vision, irritation even? Look up, please. Just gonna get a closer look here. Okay. Look down. Gonna lift your lid. Good. And to your right. And your left. Perfect. Any sensitivity with me shining the light that close to your eyes? Yeah. Okay. Is that about normal for you though? Yeah, some people are more sensitive to the brighter lights anyway, so if it's not normal for you, please tell me. Alright, and I know my gloves are not the most satisfying to look at. Let me pull them down. We need to find me the right size. But I'm going to bring my fingers in and I want you to tell me how many I'm holding up, okay? Alright, good. Mm-hmm. 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 Good. Perfect. Good job, yep. Tried to trick you. Okay. Okay, I'm going to hold up some colors. There are cute little decorative capsule buddies we have in the office. Just to make people smile and whatnot. I'm going to pull out a color and I want you to tell me what color it is, okay? Alright, what is this little one? This little fella? Good. Oh yeah, no, this is not real medicine. They have little note papers in them. So you can leave little notes for your friends, but we just use them as decoration. See, this one's winking. Yeah. Okay, well, what color is this? Good. And what about this one? Mm-hmm. This one? Mm-hmm. And lastly, this one. Okay. Good. Let's move on to your ears. Alright, so I'm going to come over here and just take a look inside your ear. Looks good on that side. Let's try this one. Good. Okay. And no blood came out of the ears, nothing like that when you fell. Okay. Alright, so I do have to perform some tests. I'm going to tell you some words and I just want you to repeat them back to me, alright? So we're going to cover this side. Orange, apple, banana. Good. Alright. Pears, peach, coconut. Good. Yeah, I was having a hard time thinking of fruits. That happens sometimes when you're on the spot like that, but let's try numbers now. Start on this side. 5, going to make this noise with my gloves. Can you hear that from over here? Okay. And I'm going to do it right next to your ears, and I want you to tell me when you hear it, okay? And then when it stops. All right, here we go. Mm-hmm. All right, now close your eyes and we'll try it again. Mm-hmm. Okay, and now keep your eyes closed. I'm going to make the same noise. I want you to tell me when you don't hear it anymore, okay? I'm going to be moving them away from your head, and we'll just kind of fade out, all right? And we'll just see how that goes. If you stop hearing it before I've stopped, then we have something to worry about, okay? All right. Good. Good. Perfect. All right, so everything seems good there. Let's move on to your nose now. Bringing the light back in, and I'm going to get up close here. Yep, and we're just going to check your nose. No pain or anything with your nose, correct? Good, okay. Alright, looks good. Nose is fairly simple with the test. I'm going to cover one of your nostrils and have you breathe in and out, and then we'll do the same thing with the other side, okay? Okay, go ahead and breathe in and out. Good. Breathe in and out. All right. And again, I'm going to need our sample here. Just some little scent pods in this container. I'm going to wave it under your nose, and I just want you to tell me what you smell, okay? Here we go. Orange, good. Alright, that seems good as well. So far you're checking out just fine. I'm not concerned about anything really there. And lastly, we're going to do the sensation part of the test as well as reflexes. Okay, so let me get out some new cotton buds here. And we'll start with the reflexes because those aren't always the most fun. I need you to let your jaw kind of like hang, I guess. Yeah. Yep, there you go. I'm gonna rest my fingers here and just. Good. I'm gonna put my fingers kind of along your collarbone here, just looking for different reflexes. Yeah, if I'm doing anything too hard or you're sensitive, let me know, because I do not want to be hurting you, of course, and that could give us a sign that something's off too. So now I need you to hang your elbow kind of like over my hand here. I'm just going to hit my thumb. Same thing on this side. Good. Now go to your knees. Okay. Alright. And your ankles, okay? So come down here. Alright. That's looking good as well. And if you wouldn't mind, I need you to slide your shoe off because I need to run the end of this reflex hammer. I don't really remember what this side is called, but there's this little point here. It's not going to hurt you, but I just need to run it along your foot. Thank you. Okay. Yep, just trying to see if your toes curl up. And then I'm going to do the same thing with your hands, okay? Okay, good. Alright, I'm going to now test if you can feel the difference between soft and sharp. Have you done that before? Okay, yeah. So let's start with you closing your eyes, and I'm going to just touch your face in different spots with this tool, and I want you to let me know what part of your face I'm touching, okay? Alright, here we go. Yep. Good. Good. Perfect. Okay, so that was the soft. Okay, so that was the soft side. Now I'm going to use the more sharp side. Okay. Just the same thing. Tell me where you feel it. Good. 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 Okay. And could you tell the difference between the two of those? Alright, so let's begin then. I'm going to do both now, and you just tell me where I'm poking your face and if it was soft or sharp. Okay? Yep. Good. Good. Perfect. Yep. Yep. Good. 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 Great. Okay, so that seems perfectly fine there. I'm going to have you close your eyes again. And I'm just going to brush your face now. Give me your hand and I'll show you what this feels like. Alright, there you go. Yep, just a big fan brush. Same thing. We'll just do light touches. Do you feel that? Okay, and how about that? Good. And I'm going to do under here. Yep. Okay. Great. Now, I'm going to touch you with a new object, and I want you to describe to me what it feels like to you, okay? Yeah, scratchy. Yeah, it's not exactly steel wool. I wouldn't do that to anybody's face, but okay. So tell me where you feel this. Perfect. All right. And now I'm just going to do basically the same thing, but with temperature. Focusing more on temperature. Yeah, you can keep your eyes closed if you want. Okay, so I'm going to gently touch this to your face. What does that feel like? Cold, wet, yeah, okay. But I mainly want you to focus on the cold sensation, okay? Alright. And can you tell me what this feels like? Warm, good, okay. So we're going to go back and forth between those, and you just tell me which one's which. Okay. Good. 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 Perfect. Okay. Again, light touch. Just let me know if you feel it. Good. everything's good. Okay, so I have no concerns for you whatsoever when it comes to your cranial nerves, okay? Of course, you do have the bump there, so we want to watch that, but I'm going to send a note to your primary doctor and let them know that everything's perfectly fine and you don't need any further treatment regarding your cranial nerves, just some ice on that bump and a little bit of relaxation as well. Yeah. Yes, and if you are experiencing headaches, of course, I would assume you probably do from time to time with how big that bump is. Any over-the-counter pain medicine, totally fine to take for that, okay? Okay, so everything's good then. Right. Is there anything else I can do for you today? Okay, perfect. So, yep, you are good to go home, and I would just recommend a couple days off work if you aren't feeling up to it. And just relaxing and some ice. And you should be back to normal soon, okay? Alright, thank you so much for coming in, and I will see you soon, okay? Alright, bye.